Welcome. I'm so excited that you joined this video today. My name is Dr. Farzana Hoque. I'm an associate professor of medicine. This is a special video because we have a wonderful and esteemed guest with us today. She is the professor of pediatrics, division chief, and associate program director, wears so many hats. Her name is Dr. Aline Tanios. In this video, we will learn that what are the other side of a story, what are the program directors are looking for in a successful residency candidates, and also how a residency candidates can thrive and stand out during the residency training. Let's start. Thank you so much, Dr. Tanios, for joining us today.
Dr. Hoque, thank you for having me. It's an honor.
If you kindly tell us a little bit about yourself, that will be wonderful.
Sure. My name is Aline Tanios. I am a full professor in pediatrics, as you mentioned. I'm a pediatric hospitalist, and I'm the division chief here at St. Louis University. I love what I do. I love caring for children with medical complexity. I also love to teach and mentor residents, students, see them growing and reaching their full potentials. So I'm one of the residency program associate director, and I've been in this position for 6 years now. So I have quite the knowledge and experience working with residents when they were candidates for residency, as well as when they were candidates for fellowship or even career development.
That's wonderful. And I know that you have accomplished so much as a physician, as educator, as mentor, as physician leader, as well as associate program director. So we are so much honored to have you. And I will jump into one of the very much burning question to all of our residency candidates, regardless of their specialty, like internal medicine, pediatrics. Truly, what do you look for in a successful residency candidates as an associate program director?
Yes, that's a very good question, because every program has priorities, and every program look for certain criteria, certain traits in their candidates that will match with the culture of their program. For us, and I would say actually in general, residency program leaders look into one, strong applicants. And when I say strong, it doesn't mean that it's just strong on paper. Mm-hmm. Strong as far as good communicator, a doer, an achiever, a well-rounded one. Mm-hmm. In other words, you would like to have people joining your program who can be excellent team player, can be coachable, can be resilient and adaptable to the never-ending change of the healthcare arena. And sure, yes, we do look at their scores, at their ability to engage with other team players, work with others. Therefore, they should be well equipped to start residency and run, not even walk. They have to run. So just so they can achieve their goals within this span of 3 years or 4 years, whatever the residency training is.
That's actually a very, very important message you just shared. I would definitely echo that, during the residency, we are looking for a person whom we can rely on, who is Absolutely. A good team player, can do the work, right? And most importantly, can take care of patients, definitely under supervision, however, have that mindset that, okay, I'm here to learn as well as I'm here to serve my patients.
100%. Like learning, serving is what brings you into this field. I mean, all of us are in this field because we love taking care of patients. We love to give from ourselves, our mind, uh, our own time. But you also have to have the strong knowledge, a strong experience, great skills. So all of these come in hand hand. They come hand in hand.
I completely agree with you. That brings to my next question. So, what are the red flags to you, like, when you were reviewing the applications, or red flags during the interviews?
Yes, this is very important, because if you do not know what can be considered as a red flag, you can easily fail that first step of presenting yourself as a strong candidate. I'll start with some of the technical one and address some of the non-technical one. The technical one is a strong resume, CV, portfolio, whatever terminology you use. That bio you're presenting and you're sharing with the world should be dense, should be heavy with whatever you've achieved. Now, I probably will divide them in several categories. One of them is the list of awards or recognition you've received in your institution, the list of research work you've done, the list of scholarly work you've done, whether you've presented a poster, whether you've presented a workshop, a session, educational center, whether you've built a portfolio, whether you've built a module. So there should be some scholarly work in that application. Another one would be community service. As I mentioned earlier, we care about the person as a whole. Do you care about also giving back to your community? You can be, it could be something that you've done the same one thing, but the same thing for several years. That means a lot. That means that you've been loyal to this mission that you are passionate about. Other than community service, we do look at some of these roles that you fulfilled, whether in any of these areas. Did you serve as a leader? Did you serve as a team player? That makes a difference. Now, you can be, I mean, not everybody's going to be a leader with all the projects. Somebody else has to step up. But being a leader does show that, one, people have trusted you in this role. Two, that you are able to micro and macro manage whatever project you're working on, as well as knowing how to deal with others. Again, you're in a field where you're going to be working with others all the time. So these are some of the technical stuff that I mentioned in the CV. Other stuff are obviously the letter of recommendation coming from people who you've worked with. While these are important, sometimes they can be cliche. I mean, people who have done this a lot, they can read between the lines. They can read who is like literally a superstar and who is a good candidate. But if you're competing with a superstar, it's going to be hard to beat. So this is like between the portfolio, the letter of recommendation. Now comes the big red flag on interview day. Do you have some social cues? Are you respectful with your communication? Are you well groomed, well dressed, well put together as a professional? Because keep in mind that nowadays we do all virtual interviews, so we have a very short period of time, this 20 minutes, 30 minutes snapshot time for us to read your body language and the way you talk. The other thing is that, are you paying attention? Are you dazed? And how much are you engaged? And how much are you really interested in our program? So I wouldn't interview somewhere where I have really no interest just for the fun of interviewing. One thing I should mention that is a big red flag: a CV that is very light. That raise big red flags, asking ourselves, so what did this person do? because while others have done million things, this person did, unless the personal statement that they shared with us, can reveal some of the hidden information. But usually, if your CV is thin, um, this is not um, this is not very appealing to anybody.
Completely agree, and day by day, this residency is getting like much, much more competitive than truly when maybe I was applying for residency. So,
Absolutely.
like as you mentioned, now we are looking for superstar. We do not have to be, Nobel winner. Definitely, we are not asking for it.
Agree.
However, we need those like hardworking people
Yes.
who are committed.
Yes, agree. And you know what? And the other thing is, like, sometimes in the past, there was a common denominator that everybody's working hard.
Mhm.
Now, the definition of working hard has changed. Um, People may see this as a strong asset to the applicant, while others are maybe focusing on, um, the way you talk or the way you communicate with your teammates or your other providers. I don't know.
Agree. And now, like healthcare has become more fragmented. We are having so many people. So, respecting people, understanding other people's value, that is very important. And I always tell my uh, viewers of this channel that, okay, even if you are like, program coordinator is not marking you, but please be respectful, courteous to the program coordinator, everyone you met virtually during your interviews.
You know, we couldn't agree more. Kindness will take you places, and um, being a respected person before being a respected professional
Mhm.
is literally the foundation of your success.
Very well said. I'm an international medical graduate. I know you are an international
I
medical
am, yes.
graduate, and you have accomplished so much now wearing multiple hats at this, like, esteemed academic medical center as a physician leader, as a wonderful mentor. So, what advice do you have for the international medical graduates, for IMGs, to increase their chance of matching during the residency interviews?
Yes, I mean, you couldn't have asked for a better, excuse me, question. Um, competition is real. There has always been competition. But in order for you as an IMG applicant or candidate to catch someone's attention, you should do something that is um, extraordinary during your training, during your practice, so so people can even offer you or review your application. Um, you need to stand out. Again, it could be something simple. It could be something that has been done consistently, showing that you've taken ownership of a project that you inherited from somebody else and you took it to a different level. It could be that you went above and beyond during, well, like, let's say, your non-clinical time, non-didactic time, and you decided that you're going to be serving the less privileged in your country, in your city. You went and volunteered helping, whether it doesn't have to be like medical help, but maybe you helped with reading, for example. I'm throwing some
Mhm.
examples here. Reading for kids while their parents are obligated to provide food to their table. Something that shows that you've used your time wisely. Because, I mean, time is crucial, and you need to use it to your full potentials, whether it's in service, as I mentioned, or whether it's something that I've been, like let's say working on a remote project. Right now, anybody can work with anybody at any time, 24 hours 7 across the globe. So there's really no limitation anymore. In the past, you had to like be in person to show um, your program or the program that you aspire to join, that you're a hard worker, you really mean well, you really are interested. Right now, it could be done all over the place, you know? So, and for his IMG, people do not know how your school is structured. And even if they do, let's say they were part of the same school, but they left that school 20 years ago. Things have
Agree.
changed. So you have to show them on paper and in person how you're bringing the best of that culture, tradition. And I will say, IMG applicants are crucial to diversifying all programs. They bring tons of wealth of perspectives, of input, of knowledge. Again, they have to do their job too.
Completely agree with you. Like US is built by IMG, and I know that when I was struggling in this country to get residency interview, I did not have my green card. I was on visitor visa. I always told myself that US has been built by IMG, by immigrants, and it will continue. So if
Yes,
I am dedicated enough, I will make my place. And that is the message I want to give the audience of this channel, that okay,
yes,
even if you are IMG, maybe you are struggling like me when I was at your shoes few years ago,
yes,
when there was no like visa, not that much financial asset, but was trying hard with the limited resources. So if you continue to try hard, give your best shot, truly the world is yours.
yes. And I would add, I was in similar shoes, and I struggled miserably, and I felt that I'm treated differently. However, it did take this extra in my daily ordinary days to make my days extraordinary. And that extra didn't come at an easy price. And you know that, Dr. Ho, because that extra is what somebody else has taken for granted. For us, it's extra. You have to bypass the extra culture, the extra in the culture adjustment. Even if you're like international and you're cosmopolitan, it's different. You're dealing with like different. You're not going to, let's say, you're not a tourist. You're not visiting a town. You're taking care of patients. So these
Mhm.
patients don't care how many languages you speak, don't care about, they care about your knowledge, your skills, your communication, your ability to make them feel and get better. Um, you know, we don't have head starts, but if you're smart enough and if you're disciplined enough, you should work on the head start on your own. Your school and your training time will not give you head start. That will give you the same opportunities like anybody else after you complete your education and training. But the head start as an IMG should be a personal and tireless work.
Completely agree with you. And that's what my mentor also told, that extraordinary that come with that extra efforts. That's just the reality. Like
Yeah,
we need to do those extra work to become extraordinary.
especially at the beginning. Later
Yes.
on, it will pay off. It will pay off, and I will say it will pay off in dividends. And once I mean, you know that. I mean, you were just like selected as top 40 under 40 here. So it will pay off in dividend, but again, it will come at a price, whether you want to get there or not. Nobody's forcing you. But if you're determined and you have that goal, that's where you should put your energy in.
Yes, great point. Absolutely noted. That brings me to the next important question. I know that many of the residency candidates, truly, I had this question when I just started my training that, okay, as an IMG, I just got the residency spot, I matched, but then now what?
Mhm.
How I can carry myself, or what advices do you have for an IMG who is just starting the residency training?
Yes, yes. I mean, this is a crucial time. Matching is a celebration you know, to be proud of. But that clock starts ticking because while others are looking for, they're moving from one state to another, from one city to another, their parents are around, their support system is around, they're still going to struggle by maybe being homesick, maybe being away from their loved ones, or they may be still in town but even like starting a new system, starting electronic medical records, I don't know. But for an IMG, it's that plus a long list. And the reason I said that's when the clock start ticking is because between matching and starting, that's when the heavy homework should be done. So you can start July 1st a little bit at more ease than the one before the match time. Everybody's going to be stressed out. Everybody's a new role, a new responsibility. How can I alleviate and remove from that equation the anxiety and the concerns that tags along me being an IMG? I would highlight several. One, start learning about that place. Start looking around in advance, geographically, fun stuff to do, because you need to have a hobby.
Mhm.
You need to be you need to familiarize yourself with the main thing, like again, the way of living. The other thing is I would start looking at all of, let's say, that place website, look at the different, again, inform myself of the details, look at their program description. You do this job before you interview, fine, but how many places are you interviewing? Many, which means that you're going to forget where you really applied with all the details. So do a second round, look up, start maybe reaching out. Why not? Dear Dr. Hogue, I'm somebody who matched, and I'm looking forward to start working with you. I'm interested in this. I do have some free time right now, and I thought that maybe I can, again, it's simple. I'm not saying go overboard, but I'm saying start start presenting yourself as a strong candidate that the program is really proud to have, and that candidate is already paving their way for success.
Agree, because many of the residents, if they are coming
Yes,
for, like, US medical graduates, even if they are moving, they know the climate, they know the culture, they
yes,
may be
yes,
having some relatives, friends.
yes,
In contrast, for IMG, for example, when I started my residency, I moved from Canada to here.
yes,
It's like great move, drastic change. So
yes,
you had a great advice that I would like to emphasize, that okay, maybe reach out to the program coordinator, or maybe a senior resident
yes,
whom you discussed during the interview, that okay, I'm looking for apartment, do you have some suggestions, or do you have like maybe 10-15 minutes where we can chat, that okay, how usually the on-call
yes,
work, how usually the night shift work. That
yes.
will be tremendous helpful to have this smooth transition from the first day of the residency.
Absolutely. And it's also, you're like establishing some good relationship with some of your peers. Some programs have a peer-to-peer mentorship, like ours have peer-to-peer mentorship, and we pair up rising senior resident with the incoming interns before they even met, before they even start, and start helping them. Somebody like, if you're interested in bike trails, start with something. You're not going to be like talking medical stuff, but you're talking about like the day-to-day thing, the stuff that is going to be part of your life. And um, uh, as well as, let's say, looking at the stuff that your culture um, will is part of your transition. So, for example, you may want to look at the grocery stores that sell or share the ingredients that you like to use when you're cooking. You may want to look at some of the religious places, if you're religious, where you can practice your religion or your faith. So, learning about that stuff uh, gives you a little bit that peace of mind that you don't
True.
have to worry about it later.
Right. So, another very important question I know that many of the candidates have, because, although all of us aim for higher scores, but
Yes,
not always possible,
yes,
there could be some failure in their steps. It can happen.
yes,
What suggestions do you have if a candidate has any fail in any steps or has low USMLE scores?
yes. Uh, You know, this is part of training, this is part of life. Yes, everyone is aiming for higher scores, never ending successful stories. Sure, but I mean, things do happen. Um, Showing that setback didn't throw you off, showing that setback served as a foundation for a strong comeback with like a good, you know, um, portfolio help tremendously. We as residency program leaders love to hear successful stories following any failures, whether it is a personal, scholarly, anything, not just like USMLE testing. Now, I do know that right now the USMLE are not, these USMLE tests are scored as pass or fail.
Mhm.
Um, yes, okay, fine. But a lot of programs are struggling to classify who is a stronger candidate at an academic level or not. This is when now, more than ever, having a strong portfolio shows um, how well prepared you can be.
Agree, because now as the USMLE one is pass or fail, and there is no CS anymore. There is like OT.
Yes,
So main focus is USMLE CK. However, as you mentioned, which is very important, that okay, what are the other things in your CV, like any poster presentation, any research? You do not have to publish, you do not have to do
agree.
clinical trial. However, at least you are working as a volunteer with some attending with some, reputed physician.
Yes,
That gives us a idea as the interviewer that yes, this candidate is willing to work, is focused on scholarly activities
yes,
that all the time are like desired by any residency program.
agree. And because the thing is, like for clinical training, everybody's going to be seeing patients. And I'm
True.
not belittling this. This is crucial. This is what we do on a daily basis. But for training purpose, being part of a project, even like what we think, oh, it's one line on a CV, that takes a lot of work. That takes lot of like sleepless nights working on a project, working on editing, adding, reviewing, literature review. I mean, it's a lot of work. But, you know, it does make you look that you're cruising.
Yes. Dr. Tanya, so what are the characteristics you believe is very important for a successful pediatrician or truly a pediatrician whom you will trust?
Yes. Oh, I love that question. Because I'm a mom, and I tell my residents all the time that you need to present yourself as a strong pediatrician. I would say strong and trustworthy,
Mhm.
so parents can trust you with their own children. As a parent, nothing is more important than your own children. So for them to trust somebody else to care for their children, that takes um, a lot of effort. So a successful pediatrician must combine several traits, and I will list few. Um, Knowledge, never-ending um, curiosity, learning the latest advancement in pediatrics or in medical field, clinical skills. Treating kids is different than treating adults. You
Yeah.
have to be creative. Um, you're talking to these humans who share their feelings differently. They may be screaming, they may be kicking, they may be smiling, they may be like asking you for a hug. So you need to be very flexible with their needs. You cannot be like a standoff. It doesn't work like that. Sometimes like you have to kneel. Sometimes you have to crawl with them. I don't know, like just to be able to listen to that chest. So like that kind of being a little bit loose. Ability to switch quickly in the same time, in the same room, from being this uh, funny, playful person to this confident, empathetic, knowledgeable physician talking to the family right now. So the juggling and switching these hats in the same, literally in the same setting, is a skill you will learn on the go, obviously, but you have to be like ready for that, because then they have to take you seriously. They have to know that, yeah, she knows what she's talking about. Um, the other thing as a successful pediatrician is um, the ability to focus on what we call like family-centered round. We don't treat kids, we treat kids and their whole surrounding family. And then with that, we have to work with the dietitian, the case manager, the nurse at the bedside, obviously learners, social worker, pharmacist. So we have to pull everybody, have the patient in the center, and you also have the family on the other side. So all of us should be ready to help this kid, take everyone. So again, this communication, this ability to listen is, oh yeah, listening is probably number one. Listen and process immediately, and then deliver your final diagnosis or your plan. Now, um, with the emergence of, not the emergence, actually with the current situation, everybody has access to um, tons of knowledge. I call them, we call them like the Google MD, and you will be challenged because they're going to say, well, my neighbor's kids had this ear infection and they treat him with this antibiotic. How come that I'm not on this one? Well, so sometimes it is frustrating because you have to just step back a little bit, go to that level, reassure, and then re-implement whatever you. So with adults, I feel like you just tell them this is what it is. They talk to you, but with kids, it seems like um, the whole. I usually joke. I'm like the whole royal family is is involved with this plan of care.
I will augment that absolutely because I am an hospitalist. I'm treating mainly the adult patient, which is very, very different than treating a child. And as you mentioned, treating a child is not only treating a child, you are literally treating the whole family
I agree. Treating the
because
child
their
is
whole
easy.
emotional need.
Yes, yes. Treating everybody else is, and don't get me wrong. Like I said, I'm a parent. I need to understand what you're telling me. I need to understand why I should trust you. you know. But then, as a physician, I also have to be clear, like I said, empathetic, absolutely, but also assertive.
Agree. Like it's a fine balance
Yes,
of like
yes,
confidence and humility.
yes, agree.
Dr. Tanias, any final thoughts for our residency candidates, please?
Um, this is my advice, not just for resident candidates, but this is my advice for myself, for my kids, for my trainees, um, to never settle for average, but that successful journey that you're seeking for will come with tons of setbacks. Use them as a foundation for strong comebacks, and you will be unstoppable.
I certainly know after talking with you, after interacting with you, you are a full professor, you are division head, you are associate program director. However, I know that every day how much you are dedicated to your patient care, how much you are dedicated for your personal and professional growth. So yes, you are definitely a role model, and
Thank
I
you.
echo
Thank you.
this wisdom of you.
Thank you. Thank you. One, you have to love what you're doing, but you also have your own personal life. I'm a mom. Like as I said, my husband is also a physician. We were both IMG candidates, and we have 4 kids. And you know, you come take care of your patients; they're your priority. Outside here, obviously, my kids are my priority. And I got a very valuable advice a long time ago is that it was 2 things: be bold and be present. And yeah, you have to be present. If I'm at work, I'm at work. If I'm at home, I'm at home. Sometimes, yes. Did I make mistakes? Absolutely. You take home with you, you take home to work, and you take work to home. But then you start, you live and learn, and then you realize that this is my time here. Let me focus here. And then when I'm wearing my other hats, I need to be fully present for my surroundings.
True, we wear multiple hats at the same time, as you mentioned very beautifully and so eloquently, that, okay, we need to be present. And my mentor told me that, okay, never carry, work to home and when vice versa. Try
Yeah.
to have the separate line.
Yes. Which is, it's not like a rigid uh, plan, um, but it's doable. Not all seasons. You're going to have, this journey will have tons of seasons of failure, season of disappointment, season um, of huge setbacks. But if you persist, you will be like reaping and harvesting tons and tons of successful stories, to the point that you look at it and you're like, wait a second, I was the one who was so miserable and so exhausted and so hard on myself to get to point B from point A. And now it seems like, the exponential growth keep going. Um, Again, it does take ownership, discipline, and consistency. And humility. Yeah, I shouldn't forget that. Yeah.
Yes, completely agree. Thank you so much, Dr. Tanios. It was such a valuable session. I truly appreciate you taking your valuable time to sharing your wisdom and valuable insight as an associate program director to our audience.
Well, I'm truly honored. I was truly honored, and you know how much I treasure our um friendship. more than the collegiality now. And I admire the work that you're doing. This is huge. This was not present. This is something that we would have been really thrilled to have back then. However, I feel like this platform should help enlightening any candidate and empower them, but they have to do the work. Like you're providing them with tools, but these tools can be sitting on that bench or that table unless they're getting used, and they have to use them.
Great point. Thank you so much, Dr.
Thank
Tanios.
you. Thank you. Thank you.
And thank you so much, everyone, for joining us today. I hope you found this video helpful. Dr. Ellen Tanios is the Professor of Pediatrics, Division Head, and Associate Program Director. Please listen to this video. I believe you will learn a lot of valuable insights from her wisdom. If you like this video, please hit the like button, share with your friends, with your colleagues whom you believe will be benefited. And please subscribe to this channel, which means a lot to me. Thank you, and I wish you all the best to your professional growth.
Thanks again. Thank you.